the recording right now, so just so that you're cognizant of that, that we are recording if you do start your camera, just so that we are able to share it with the self-advocates who cannot be with us today. I want to introduce our speakers. First, we have Dr. Suzanne Bartlett Hackamiller. She is an OBGYN and integrative medicine physician who works in Waterloo, Iowa. She's the parent of a 20-year-old son with autism and has been a board member and past president of the Autism Society of Iowa since 2005. Dr. Suzanne will share her perspective based on her experiences as both a medical provider and a parent, with the goal of empowering listeners to get the most out of their healthcare encounters. Marie Ugorak is an autistic ADHDer with co-occurring EDS and secondary anxiety and depression. Marie's neurodivergent diagnosis were medically confirmed in 2019 and 2020 after she came to suspect that there were one or more neurological differences underlying the fact that, despite the anxiety and depression being consistently well controlled over 2 decades, her ability to function in society had decreased rather than increasing. Marie lives in Cedar Rapids with her husband of 20 years, where she works part-time in Christian education. So thank you, Dr. Suzanne and Marie. The first thing that we were going to start with, and we're going to kind of do this as a conversation, we're going to start with Dr. Suzanne, and we're going to start right at the beginning when someone makes an appointment. And the first thing is the waiting room can sometimes be difficult, and then trying to organize the information that they really want to share with the physician on that first visit. So Dr. Suzanne, what are some of the first steps when you realize that a patient is coming who has disclosed that they have a disability, especially if it is autism, and going forward with that?
Yeah. And so I'm going to, as Chris said, speak from my multiple hats, both from my perspective as a parent and also as a provider. And I think there are things that we are constantly learning that we could do better as providers. In fact, I learned a number of great ideas just the other day when Chris and Marie and I met to discuss what we were going to talk about today. But I think it's really important, if you can, to be aware in advance that a patient with any kind of special needs is on the schedule, because there are all kinds of accommodations, whether the patient has autism or has a hearing impairment or a visual impairment or anything like that. Obviously, those are all things that we would want to take into consideration and perhaps even lengthen the amount of time that we have for the appointment so that we can make sure we take care of everything the best we can. I think one of the things that we can do a better job of is, if you think about it, probably most of the time when you're a new patient at an office, you'll get paperwork to fill out. Either it will maybe come in the mail, or sometimes you can do it online, or you might be asked to fill it out when you arrive in the at the office. I think it's always really great for all of my patients, and I always try to do this when I'm a patient or my kids are a patient, is to try to arrive at least 15 minutes early for the appointment, just in case there is any new paperwork like that that is going to need to be filled out. But one thing I think that we as providers can do a better job of is including some questions on that paperwork that maybe hasn't traditionally been asked. I think that it could be helpful for us as providers to ask the question on the paperwork, do you have any need for accommodations? And that's across the board for anyone who might, regardless of what the accommodations might be. I also think we talked a lot in our preparation meeting about people being able to identify themselves in whatever way they prefer. When I was in my medical training, we talked a lot about person first language, where we would never refer to a patient in the hospital as the heart patient in room 202, for example. That's an absolute no-no. So we were taught instead to say the patient with heart disease in room 202. And so as a result, my background and training was to treat people with autism or any condition in that same way. However, as Marie will share with you, there are differing, and I have a cat that just jumped on my lap, speaking of cats, Marie. people have differing preferences for how they would like to be addressed. And that would be something that as providers, we could add to a form, I think. So these are, we can get into much more depth about this as we continue to converse, but I think it's important to plan for all of these things. I think ideally, one thing that could be very helpful is having a sign in the waiting room that an individual could, that would say, please let us know if you need any accommodations while you wait. And that's something we talked about that could be very helpful. So I'll stop here because I know we have so much that we want to get to and talk about. And some of these are things that Marie was probably going to talk about. So I think we can all keep learning and doing better with these things. I guess the other thing you mentioned, Chris, before I stop, one of the things that I've found to be the most helpful is when my patients really come prepared with what they think their most pressing issues are. And ideally, and this goes again for all patients seeking medical care, it's best if you can confine your number of major concerns to no more than 3. And to try, if you can, even in advance, to perhaps write down the characteristics of your symptoms in as much detail as possible. And sometimes it's helpful for me if the patient will just even hand me that list so I can just quickly scan it. And then I know what questions I need to take from there, as opposed to you having to try to figure out what I might need to know. But it's really, really helpful to narrow it down to no more than 3. And that allows the patient then to get the best care possible, because the physician can focus on those needs and not get off on some tangent that turns out not to be as important to you as the doctor may have thought it was. So now I will stop, and Chris, you can kind of take it from there.
Marie, do you want to share some of the ways that you have learned when you're in the waiting room, some of the things that may be a trigger, some of the things that have helped you, and while you're waiting for the physician to come into the room, please?
Okay. Well, in the waiting room, the biggest thing for me is that I have to know where the TVs are, because waiting rooms now usually have, well, they all have TVs, and most of them have multiple TVs set on different programs. And it's, you know, it's kind of cacophonous. So I have to try to position myself where I can see as few screens as possible, and preferably someplace where I'm not hearing something that I'm seeing a different vision. Like headphones are good for drowning that out. I tend to take my phone with my Pandora channel ready. And that is actually an accommodation I've asked for, because a lot of places will be like, no, turn your phone off beyond this point. I'm like, okay, look, this is what I'm doing with my phone. And they've been okay with that. But I had to know to ask, which, I didn't until a year ago know that I needed to ask. So sometimes it's important to offer, because the person might not know that they need an accommodation. They might not be aware that there's a reason. They just might be aware, they just might be aware that there's a, I'm having trouble with words today. I'm sorry. Okay, well, this goes into another thing that one can do, which is to prepare scripts ahead of time, which I had to do this morning, because I'm sort of at I hit a point in my mental health care progress that was inconvenient to hit right at bedtime last night. So I'm sort of holding off on dealing with it until after this, but that means that I'm having a little more trouble verbally than I normally do, and I might be easily triggered, and I'm really self-conscious about that, apparently.
You're doing a great job, Marie.
Yeah, my brain knows that. The rest of me hasn't caught up yet. But I took time before I came in here to write out, knowing that I might not be able to speak, or at least not be able to speak coherently. And I might have to switch to chat and say, okay, this is what's going on. And so I wrote out what I would need to say or what I would need to type. so that people would know what was going on and know not to panic. And, I kind of made a list of the things that I would do to deal with that. And those are important things to prepare for those of us that do know we're going in with a difficulty.
And Marie, that makes me think of something that might be helpful would be to take somebody with you, who then, if you got to a point where you couldn't think of what you wanted to say, perhaps your family member, your spouse, your friend could pick up where you left off and give you a break while you could collect your thoughts, or even read off your list of questions for you. Is that something that you think sometimes is helpful?
That is preferred in most situations. It's been very difficult with COVID.
Right.
And it's very difficult for some of us who don't have a lot of friends and family, especially locally. Like, my best autistic friend is in Washington State. Like, just sometimes the people that we would want in those situations just aren't physically able to be in those situations with us. So it's important, I think. I mean, it would be very nice if I could educate all providers on, if you start seeing these signs, like, oh, I'll show you what I'm doing right now. I'm doing EFT tapping points. But like little things like this, so that that's not somebody who's losing it and doing some weird thing. That's somebody who's actively aware of their emotional state and is using coping skills to downregulate, because they know full well they're not in a life or death situation and their nervous system disagrees. Like that's basically what it comes down to.
Right.
Nervous system says jaguars are coming, and I'm like, there are no jaguars.
Because everybody is anxious when they go to a doctor's appointment. Without question. One thing that we worked with my son on was taking slow, deep breaths when he was under stress. And I've used that many times with patients, and that would be something that I might actually offer to a patient who seemed to be getting to the point where they weren't able to speak and were getting frustrated. I might recognize some of the signs that was happening, which might be something like you're doing with your hands. For some people, it might be rocking back and forth. For some people, it might be having to stand up and walk around the room or things like that. And I've experienced those things both with my son and with patients. And so I actually sometimes will say, would you like to try a breathing technique? And I'll walk them through a technique, which if anybody's interested in doing, it takes about 2.5 minutes, and we could all do it right now. You get to call that, Marie.
I think right now I personally need to stay with the familiar breathing techniques I'm using. I'll also say I have known 2 people who had trauma responses to trying to take deep breaths.
Right.
So,
and that's an
you
excellent
have to have
point.
more than one option.
Yeah, exactly. And that's such a good point, is that what works for one person, whether they're on the spectrum or not, absolutely doesn't necessarily work for all people. So it's helpful to have tricks up our sleeve, but also to be sure we ask if that would be something that would be helpful. And if it's not, to just, obviously accept that and ask what would be helpful. Would it be helpful if I step out for a few minutes? Would it be helpful if we turned off the lights? Would it be helpful? One time I took a patient of mine on the autism spectrum. We went outside. I said, what would you think if we just ditched this exam room and went outside and walked around the building? And that's exactly what we did. And it was, one of the best, really very meaningful patient encounters I've had, because we were able to then not be confined to this scary, sterile room. We were able to get outside and walk and move and breathe. And it just took a whole bunch of the sensory challenges right out of the way. And in that case, of course, we had to have more time for that patient too. But I had built that in, knowing that this was going to be difficult. Chris, did you have any thoughts or?
I did. I wanted to move on to one other thing while we're still talking a little bit about the beginning of the start. One of the questions that the self-advocates asked a lot about is oftentimes when you go to a medical appointment, the doctor might come in and say, oh, I have a medical student with me, or I have a nurse, or somebody else comes in who is unexpected, or maybe you have started to, you've already waited for a little longer than you thought in the room and you're trying to go through that. What is a good way for those to handle that if they think, no, I really just want to see the doctor, or, what is either one of you could answer that. What's a great way to maybe handle that? And then after that, we'll go on to recording the medical information that maybe is shared. Dr. Suzanne, do you want to go first?
Yeah, I've been in that situation many times, both as a caregiver, a spouse, a parent, and also as a physician where, yes, we might be at a learning institution where there might be medical students and residents. It's always acceptable, and I hope you can't hear this noise. Of course, somebody decided to weed whack outside because that's how life goes. So it's always acceptable to ask if you could possibly not have a medical student or a resident. It's also helpful if a patient can understand that it's very important for medical students and residents to be able to have this exposure. And it's one of the things that kind of goes hand in hand with a teaching institution like the University of Iowa. But also, ultimately, the encounter is all about the patient. And if the patient feels strongly enough that they need to request that, they can. Now, unfortunately, I can't guarantee that's always going to be respected. I believe that it should be respected, but I can't always guarantee that in every instance that is going to be respected. One important thing is that the medical students and the residents are a very integral part of the team. And I think sometimes people don't realize that. They might feel like they're just an experiment or a guinea pig and not realize that actually you're getting a team approach and you're getting a number of different minds and brains and thoughts on your case all working together for you. And everybody has a slightly different hat, but they all bring something to the table that sometimes I don't think people realize. And I'll let Marie speak.
Yeah, I'm usually one of those people who says, good, I'm a great person for them to learn on. But I know that that's not going to be the case for everybody. Some people, I mean, you can't do anything if someone's going to a specialist for the first time about the new people and new place. And the more new people you have, it might just be too much. And so while my personal position is that I think the more people who need accommodations, who have neurodivergence, who are dealing with mental illnesses, that are being open and honest about that with the students, the better the end result will be in the long term. But in the short term, you've also got to make it through the appointment. And so, like, don't be afraid to ask if the person steps outside the room. Don't be afraid to say, let's try it, but I may ask them to leave. Don't, ideally, yes, the wishes should be respected, and there will be situations where you're dealing with a provider you've built a rapport with and you just cannot handle a new person that day. And that would be difficult if that weren't honored. It would make the communication more difficult during the appointment. So, like, that's not optimal for anyone from any angle. And I would say the one thing I would caution is for parents or people who are there as advocates, if somebody is not able to communicate verbally at the time, don't give permission for the person. Like it's just like that's the big thing. If you've got someone there who can communicate to you that they're okay with it, then go ahead and give the permission. But don't just assume that because you as the advocate are okay, that that person's okay. Because then that makes them, that takes down their level of agency. And medical care is already an area of extreme vulnerability for a lot of people. And so you don't want to do that if it's at all possible to avoid it. But I do know that like there are autistics who are completely nonverbal, who are able to communicate just fine with the people who understand how they communicate. So I don't want to say to medical professionals, if a parent tells you it's okay, assume it's not if the kid isn't talking. But I'm having trouble concluding that one. Move on. Next.
Okay. One of the things that the self-advocates have found is very difficult too is when the doctor, they get done, at the conclusion of the appointment, and the doctor says, now we're going to subscribe this, you need to come back in 6 months. There's different things. And so what is a great way, or a good way, helpful way, to be able to start to organize that information that you get as you're leaving, that you need to remember and that you need to act on? Dr. Suzanne, do you have some ideas, please?
Well, I certainly think it's important to know if your patient is a visual learner or somebody who would benefit from having the information written down. Excuse me. I write a lot of things down for all of my patients, but I think that's important. Either the physician, the nurse practitioner, the nurse, the tech, somebody with you to write things down at the end of the visit is important. I think it's really important. You can always ask for what's called an after visit summary, which the provider can print off that lists your diagnosis and the treatment recommendations. I think that's always a good idea. Probably many of you are aware that many doctors' offices and hospitals now have portals, patient portals, things like MyChart, where you can log on and get your information that way. I think if that's something that works well for you as a patient, then absolutely. And I think those can be really good tools for being able to go back if you think, now what was that he or she said, and what was the medicine, and what were the potential characteristics of this condition, or what were the potential side effects of this medication. All of those things should be included in an after visit summary, and typically those are also then uploaded to the portal, so you'd be able to check that afterwards. And I don't know if you had other thoughts in mind, Chris, that I'm not thinking of, but if not, then Marie can go ahead.
Yeah, you pretty much covered it. I mean, I will say that it is nice now that most providers I go to ask me if I want a copy of the after visit summary, because that is not something that was happening when I grew up, and it's not something that was happening in my 20s. And and now I'm familiar enough with the systems that with my regular providers, I don't even need a copy of it because I know it's on the portal and I'm not going to lose it there. Whereas I will definitely lose paper in my house. It is important to make sure to take the time to talk about it though. I have been to specialists where they just like said the thing once really quickly. And then I had to go to the after visit report because I didn't get it the first time they said it. And for me, it's really important because I have some memory complications from time to time. It's really important that I get things verbally and in print. And if I just get one or the other, a lot of things won't stick. The other thing that I find very helpful is I try to make any follow-up visits before I leave, because I will encounter some serious executive dysfunction if I have to call and make a follow-up appointment. And for some reason, I'm still working on why and doing something about it. But if I have to call to change an existing appointment, I don't have a lot of those same barriers. So, and also I will make appointments through the portals with my regular providers as often as I can, because then I can bypass the telephone call altogether, because for me, auditory processing is not my strong suit. There's not enough information when I only have a voice to go on. And my vocal tone is erratic enough that I can definitely give people the wrong impression about what I mean when they don't have visuals for me to deal with. So it's important, I think, to make any follow-ups that you can before you leave, and to double check if there's something that someone said really fast and you caught that they were saying something but didn't quite catch what it was. You know, that's the double checking part. If there are a lot of changes, I will get the after visit report printed just so that I can look at it right there and make sure I understand it. I no longer do that when I am only having like one adjustment to my meds or something. Like, that's easy. But the other thing that I forgot to say earlier that the portals really help with for me is I will send my GP a list of all my concerns and say, what appointments should I make? So that then she's able to tell me, we're going to do a 45-minute for this, or let's do these two in a 15-minute, and then we'll follow up after we do that. She can say, okay, let's deal with these. You know, she can cluster them so that things that involve med changes don't all happen at once, because that's not generally useful to change all your meds at one time. You don't know what's going wrong if something goes wrong.
I think that's a great way to do it, Marie. We talked about this the other day. The fact that you can communicate directly with your provider, and then she can tell you, let's address this concern in this block of time. Let's address this concern on another day, maybe after you have your blood work or whatever, or after you've tried this change in medication for a couple of weeks. And that way you know what to expect. She knows what to expect. You've planned for it. There's enough time allotted. That's honestly the perfect situation. And I think probably sometimes people think they can't do this, but honestly, I think for all sides, that's ideal. Even if it's maybe calling ahead, and if you don't have that access via the portal, calling ahead and asking the receptionist, could you check with my doctor and see, I have these things that I'm really worried about. It would help me if I knew how we were going to address them, how much time to leave for each, so we all knew. I think that's a fantastic idea. I really like that a lot.
Yeah, and that is something that the long distance friends and relatives can help with. Mm-hmm. You know, you can email someone and say, can you look at this message and tell me what needs to be changed for my doctor to get it?
Sure. Yeah. Yeah, Chris.
You know, one of the other things that the Self Advocates talked about, and Maria just touched on this, is when you have labs and the lab results come back and the doctor say, well, the nurse will call you with the results. And that isn't always optimal, to have to answer the phone and to try to understand what the nurse is saying with those lab results. And Dr. Suzanne, do you have some ideas too as to, you know, can you just request to be put in the portal? If you don't use a portal, can you get it by mail? What are some accommodations for that can be made?
Yeah, absolutely. I think that's a great question. And again, this all goes back to the same idea that it's just communicating. And I think sometimes we as patients, and I'm speaking from myself and my own patient experiences, sometimes we don't feel like we are empowered to make these requests. But I absolutely think it's in everybody's best interest if we can communicate these things. And in our electronic medical records, there are often like little Post-its, like little notes that can be in the chart where I could, or my nurse could put in, patient prefers to receive results via mail, or patient prefers to receive the results by phone. And then we can do it that way every time, hopefully, ideally. But yeah, we don't always have to do the things the same way every time. Yes, many times I'll have my nurse call a patient about a result, but also I have patients who I know I'm gonna call them and we're gonna have the conversation. Or just yesterday, I had a patient ask if we would mail her results after I finished telling her over the phone. Of course we'll do that. So even if you do get the results via phone and you think, I'm never gonna remember these, or I couldn't write them down, and how will I remember what the normal values are if I write them down? Like, it's just too much to hear it over the phone. It's never wrong to say, would you mind printing that and putting it in the mail for me? Or is this uploaded to the portal? Will I see it on the portal? Sometimes it's as simple as somebody needs to check a box as to whether the result goes to the portal or not. And I've had that happen. In fact, just the other day, I was sitting with a patient. She said, I keep checking the portal and it's not in there. And I thought, well, that's strange. And I looked, and sure enough, there's a stupid box that says, do not upload to portal. And somehow that got checked. So, you know, there's a lot of room for technological and human error sometimes in these things. And so it's just a matter of communicating your wishes. And I think most places are more than happy to accommodate.
Is there
And
a way
also-
to, go ahead, Marie.
I was going to say, an issue I have with being called with test results personally, and this is something that a lot of autistic people I have noticed, we tend to be natural scientists. And when the nurse calls and says your test results were normal, that doesn't tell us enough. You know, it's like, okay, but were they better than last time? Are they in the center of the normal range, or are they near one of the edges? Maybe I actually need a higher level of that than most people do. You know
what,
like,
Marie? This is where I tell all of my patients, don't ever accept your result is normal. Do not accept that. This goes for every single person listening. Don't accept that. Ask what the number is for your own information. We all should be, you know, savvy consumers with our own medical history. And so that goes for all of us. Don't accept your test result is normal. Ask what the number is and what that means. You deserve that information. And if it's too much for the nurse or the receptionist or whoever, then they should schedule you for a follow-up so that you can get the information from the provider.
right. But I've actually also noticed that stuff that's done with my regular providers tends to hit the portal long before my doctor actually gets a chance to look at it, because doctors are run ragged. So like, when my doctor finally gets to sit down at way past the time she was supposed to be done for the day, she often will see my test results and then see the message from me saying, hey, it looks like the vitamin D3 is helping with that cholesterol level. Everything else looks pretty good. I need to be watching this. Does this sound like a correct diet tweak to work on? You know, because
you're the
I've
ideal
had
patient, Marie.
well, you see, that's why I'm good for this, because this is the part I'm good at. I can communicate pretty well with medical providers and educators. Don't expect me to get the banker to do what I want. I've tried. I've had panic attacks. It has not been working. But you know, like, you know, I can't explain something to a mechanic either. But I can talk to doctors. Like, it's too specialized. But yeah, but I've had time to look. I've been able to go through the values. I've been able to, you know, look up what the test was for and what the results are and how far off of the norm it is. And, you know, and not everyone's going to do that. Not everyone has the spoons, especially if, you know, you're just trying to get things done for the day. But that needs to be an option for those of us who, you know, because I feel so much better about it that way. And it saves her some work. and then we don't have the nurse calling back saying the results are normal and me sitting there wondering what in the heck that means, you know. Um, so, that might be something else to put on the introductory paperwork is, do you want to have access to your lab results or do you want to wait until the doctor's seen them? Because for
Absolutely.
some of us,
That's a great question.
the waiting is so hard.
Mhm.
The waiting can be so stressful. And
Right.
a lot of those test results will come back within a couple hours. And if you get the test on a Friday, the doctor's not responding until Monday or Tuesday. So
Yeah, that can be hard. You're right. And sometimes some patients would rather not have that happen where they're going to end up seeing the results beforehand. Now, I will also say, with the best of intentions, like I said before, sometimes your plan is that they're not going to go directly to the portal, and yet sometimes they do. So bear with us. The electronic medical record is one of the most stressful parts of patient care, bar none. So it's difficult for everybody. Chris, it seemed like you had another question from the advocates.
I did. One other question, and Marie provided a one pager that was on the sheet under resources that everybody got when they got the Zoom link for this Lunch and Learn. Also, is if an emergency situation comes up, and how do you have a advocate or a backup or somebody who can present the information to the hospital or to the ER or someone for you as well. And Marie, do you want to talk a little bit about the sheet you put together and the information you thought would be helpful?
Actually, what I ended up doing was coming up with a 2-page version because I realized that it would also be helpful to have my personal pain scales on there. But the first sheet is basically, they're both things that I have extra copies of them. I did the whole wrap plan thing, and then I added some other things about communication and stuff to that in case I ever have to go inpatient again. And so like I have this long document that has like all of my mental and physical health care information in it. But then I have this shorter version that's just basically 2 pages of that. And 1 page is, these are the diagnoses. And these are some of the complications that might occur. And then here is a list of things that can help if Marie is in distress. And it's got stuff that's fairly general that people familiar with autism might expect, like I prefer indirect lighting and stuff like that. But it also has stuff that's very specific to me, like if we're not looking at potential anesthesia, give me a cup with a bunch of nuts and berries in it, and I will sit there and sort them out, and that will calm me down. And then I will eat them as slowly as possible, and that will calm me down. Like no one's going to think of that, but it would be something that would be super easy to do if I'm freaking out in an ER, and so there are extra copies of that in the front of the folder that has my longer version, so that if I'm ever involved with any emergency management, like any first responders, they can get that short 1-page version right off the bat, just have it handed to them. And that way I don't have to talk. That way my husband can concentrate on telling them about the current situation instead of having to remember how to tell them all of these steps that, he knows because he deals with me every day, but remembering which things to tell them about his life, that's a little trickier. I also put in there I had developed 2 alternate pain scales because I've had problems in the past expressing pain. There's that whole 1 to 10 scale thing. And first of all, it's a little confusing. It's a little confusing for a lot of people. Like 10 is the worst pain you can imagine. I'm like, how do you know anything about the degree of what I can imagine? Like, that's gonna vary significantly. But then I also had a situation long before I realized that autism described the shape of some of the differences I was dealing with, where I was in the emergency room with a dislocated hip and fractured pelvis, And people kept sticking their heads in and asking me where my pain was on a scale of 1 to 10. And I kept saying 2 because I wasn't moving. And I wasn't moving because if I moved, it hurt a lot. So they weren't getting the information they needed, because the question they were trying to ask me was, when you're moving normally right now, what is the range of your pain? And they were, and I was only hearing at this very instant that I'm asking this question, you know, how much pain are you in? And I've also had problems where I had sedative not take effect before a procedure. And I tried to tell people this and they didn't believe me, because I don't show pain the same way most people would. First of all, I can have a very, very high pain tolerance some of the time. So like, I might not even be aware in some situations that my pain is very severe. I will have to stop and actually take an internal inventory. But also, I'm so used to putting in the effort to function in a way that appears like the majority of people through my own personal pain, struggles, challenges, whatever, that when I'm in an emergency situation, it doesn't occur to me to stop. So that means in situations where most people would be having trouble speaking, I'm still speaking, because comparatively, I'm just like, I just need to get the communication out there. And so I just do it. And because I can get out a full sentence at that point, they don't believe me when I say, no, I'm in a ton of pain, because if I were in as much pain as they think I should be in, I shouldn't be able to say it in a full sentence, you know. And it just, and my facial expressions will vary. And I've already said my tone sometimes is erratic. So I have actually also taken the pain scales, and I have one for physical pain, and then I have another one for mental and emotional pain, because I respond a little bit differently. But I've listed the behaviors I'll be exhibiting, what coping mechanisms I'll probably be using, you know, what my verbalization might be like, you know, and stuff like that, so that if I say something and it seems off, there's documentation. And then, and part of the reason I did this was because my husband at one point said, you know, she's usually right if she says something's not working and she's in pain. She doesn't lie about these things, but they didn't believe him either. And if it's already written down, that's a little bit less of a chance that they won't, you know, that they won't believe me, or that they won't believe an advocate I brought with me. And also, it's, you know, it's confusing, because I realized as I was writing it how much of, oh shoot, lost the word, how much it's out of order compared to most people, you know, because like I know I'm looking at it and I'm like, okay, if I were trying to figure out how much distress a 10-year-old were in, I would not look for these things in this order, but this is definitely the order in which I do it. So it's tricky. And so I included that too as an example. You know, there's some overlap in the stuff, and it's not as clear cut and easy to read as I'd like, but it's a suggestion. And even just as an awareness thing, you know, or for training, if you can just say, look, you know, some people are going to be, their pain scales are going to look like this instead of like this. So maybe believe them, even if it doesn't match what you're observing.
Thanks, Marie. I think that's a really good point, because a lot of people with autism do have pain levels that may not be typical. At this time, I'm going to take some of the questions that we have in the chat room. The first one is, what advice could you give to any of us who have nonverbal autistic children who have anxiety when they need to have shots? Dr. Suzanne or Marie, would either one of you like to?
I mean,
Answer
I'll
that?
just tell you what I've done with my kids, and it involves ice cream. And I don't know, but that has worked. We always get ice cream after shots. No, that's not a great answer. So I'm going to let Marie take that. But well, I'm going to say, I guess, with my son, I think what has worked best with him is I typically don't talk a lot about getting shots like a week in advance, for example. That would cause him undue anxiety about getting a shot. But I will definitely tell him before we go that he'll be getting a shot, because I think that's only fair. And then he can be prepared and he doesn't feel like he's being tricked. But we do have some kind of protocols. And like I said, it always involves ice cream, even at the age of 20. He just got a shot the other day and we had ice cream afterwards. So, you know, I just think it's fair to be upfront about it with him, but also not to cause undue stress by way too much time to think about it. Marie, what do you think?
I would say also point out that if the only time you're really having a problem with anxiety at the doctor's office is when being, you know, stabbed with a needle is involved, I think they're doing pretty well, and you should let them know that. But yeah, basically the same thing. Prepare them. If you don't know, say you don't know. You know, if it's a matter of, well, it depends on what the doctor sees, because this could be a thing that they need to treat you with, something that would be injected. It could be something you can take a pill for, or it could be something that we're doing something else with. Say you don't know.
Those
And
are
then
great
tell them what
answers.
the options are likely to be. And if it's going to be a multiple booster shot, do warn them of that. I also like Beanie Babies a lot for anything involving needles. I particularly like them for blood draws, because what I do is I tense up in advance and then I consciously relax during the blood draw so that I'm not tensing up while they're trying to take my blood. And the Beanie Babies are just right for me to squeeze and let go of. It doesn't have to be a Beanie Baby. I just find them to be like the right pressure level for my hands. But having a plan on how you're going to deal with it, because, you know, it's not, people who don't experience anxiety a lot often think it's all in your head. And it's not all in your head. It's a full-on autonomic response. And so you need to have a plan for dealing, especially if you've got someone who's nonverbal. I'm hyperverbal, obviously. So, you know, so like this hasn't really been a problem for me. At least it wasn't when I was a child. But it kind of, you know, it have a plan. It goes for everyone. But especially if they aren't going to be able to speak, because if they've got a plan ready and they're doing something different, it's because there's a problem. So not only does the plan help them cope, it also helps them communicate when they're not able to cope. So I think while that's good advice, like I said, for anyone, that would be particularly important, I would guess, if you've got a nonverbal individual, because, you know, I mean, I've had nonverbal spells where I literally couldn't think because I am such a verbal person that if I don't have words, I don't have thoughts. And that's like incredibly frightening. And I don't even know how to communicate to somebody that I can't think, because I'd have to have words to have the thought to communicate it. So, you know, if you have that plan, then you know if the plan's going off the rails, then that's communication right there. Yeah, I've said that 3 times, I think now, so probably covered it.
Great. The next question is, if you have a different person, past info usually needs to be done over again to catch them up. Not only does this take up potential progress time, it can be upsetting to the person with ASD. My son recently told me, though he needs my help with his history, it's the worst part since he hears it as a list of all he's done wrong or can't do.
Yes.
Dr. Suzanne, do you want to talk about that first?
I
You're,
was sending a heart to the previous question, so I didn't catch the first part. So sorry about that.
it says, if you have a different person, past info usually needs to be done over again to catch them up. Not only does this take a potential progress time, yeah, it can be upsetting.
Yeah, I think that's something we talked about in our kind of planning meeting, that it can be frustrating when the provider asks you what you're here for or doesn't seem to know. And many times they do actually know what you're there for, but they do want to hear it in your own words, or or I will say many times my patients will schedule their appointment and not give any indication what they're there for, and what they're coming to see me for is a completely other reason. And so I do always, every single time, ask my patients what I can do for them today and what they're there for. So, and I'm not sure if I really answered your question well, Chris. So if Marie wants to give that a shot.
Marie?
I want to give that a resounding yes. Breaking in a new doctor or therapist is the worst. I can't tell you how often, like several, well, I probably can. I can several times a week on the Facebook groups for autistics. There's somebody up there going, okay, should I fire my therapist? Because I really, really don't want to have to catch up a new one.
Yeah.
But this toxic situation is occurring and I can't communicate with the person. And so we're all like, yeah, you should probably break in a new one, but oh, so sorry. Like
It's hard.
it's really hard. It can help to have it all written out, because even though they have to ask, then you can like ask them to read it. It can also help, and that also helps because if like you and your, was that a son specified in there? I don't know why my brain is saying that necessarily. Anyway, yes, son. That's why, because said it. If you and your son sit down before you go into the doctor and talk about the history that might be relevant, then he can leave the room while you're giving the history, because you have got the notes down there. And then the doctor can just, when he comes back in, double check with him that you got that correct. Now, your son might not be as comfortable with that as being in on the conversation, but at least then there's an option. And I would definitely, establish up front, okay, sometimes when we're going through the history, this is a little triggering for him. So is it okay if he just ducks out in the hallway?
I think that's a great idea. And then they can also sometimes give an abbreviated or a speed version that will take less time than the whole starting from scratch. I've had parents of people on the spectrum and other conditions or no conditions. I've had family members send me an email kind of filling me in on things, or ask if they can give me a call before the appointment just to kind of give me an overview. And that's a great idea. And I think if you do hand it to them in writing, if I could again suggest, maybe think about putting it in an outline or bullet points. I can tell you most providers probably don't have time to read a 3-page letter about what's going on, but would love to be handed a list of bullet points of, age 10, this happened. Just kind of some quick points about your history that you think are important. That's a great idea.
And we have one last question. Dr. Suzanne, this is from a self-advocate. If they are having some issues and it's too hard to pick up the phone and call a doctor and leave a message with the nurse, but they do not use the portal, is there any other option, or is the only other option to have somebody else call for them to get that information? For instance, does a doctor ever text?
Oh, that's a good question. I do personally. It definitely can be done. Most office phone systems are not set up to text. I'll tell you right now, you can suggest your doctor use an app called Doximity. In fact, you might want to write this down. It's DOXIM, Doximity. And it's an app that does allow a provider to text a patient, to even do a telehealth or video call. Thank you. Doximity.com. So for example, if I wanted to use my personal cell phone, it doesn't show up as being my phone number that then goes to the patient, which I don't advocate that any medical provider use their private cell phone when communicating with patients. There are a number of reasons why that's not a good idea. One of which is it's not HIPAA compliant. This Doximity app is HIPAA compliant, so you can do a FaceTime video call with it. You can do a telephone call with it. You can text through it. And so, yeah, I think that's great. And I mean, I personally am a fan of texting. And so, yeah.
Great.
Yeah,
Well, I
and,
want
and I, well,
oh,
I
go
just
ahead,
wanted,
Marie.
I just wanted to say that if that information about, you know, if you need an alternate method of contacting us, put it on there, because like I've had situations where I've dug into the fine print on web pages to find an email address, to email saying, I know your website says call 17 times, but I need to see a dentist and I've been trying to call for 3 weeks. So can we please do this over email? You know, so like if there is an alternate, you know, let people know what it is, because some of us, and you know, sometimes we're not going to do that. Sometimes we're just going to go the 20 years without seeing the dentist first, which I don't recommend, you know, like, but it's so helpful. And I forgot to say, have photos of the waiting room on the website, because that helps with the prep work.
That's great. And
Great.
that allows for making kind of a social story too, which can be helpful for younger kids. And I certainly did that when my son was young.
Wonderful. Well, thank you, Susanna Marie, so much for all of this valuable information and willing to share it with us today. For everybody that is on this Lunch and Learn, follow-up email will come with the recording, and then also the resources, and also will include the Doximity information too, so that you have it in the handout. So thank you to everyone. If you think of a question you might have for Dr. Susanna Marie after this ends, please just email me. It's autism50ia@aol.com, and I can get that question to them as well. Thanks, everybody, and have a great rest of your day.
Thanks.